Hello again. This is Bob Dennis talking to my friend and colleague, Stacey Ravid, about what are we going to talk about today, Stacey?
We are going to talk about the use of micropulse for pain, specifically for dental pain.
Excellent. All right. So once again, an unrehearsed discussion. Why don't you tell me what you have on your mind?
Okay, just to inform people, I completed a dissertation study on the use of the micropulse for participants who were experiencing pain, and they used the micropulse on all different types of pain. About 2 weeks ago, I had something happen to me. I had dental pain in a left lower molar, and it was probably the worst pain I've ever experienced in my life. It was worse than childbirth pain. And it was during a time when I could not get to the dentist, and I tried some ibuprofen and different over-the-counter medications, and nothing seemed to really help. So I started using the micropulse on it. I had been out of town. I was waiting to get back to my dentist, and I used the micropulse. All I can tell you is I was in so much pain. I wanted to go to a dentist I didn't even know and have him just take the freaking tooth out. It was incredible, deep nerve pain. The micropulse at first gave a little bit of relief, and then after using it for about a day, and I used it like 2 hours on, a couple hours off. So the first day I used it about 4 hours. Second day I used it about 4 hours. On the second day I started having relief. On the second day I was able to eat again. On the third day I was able to sleep through the night. And so I used a special type of adhesive bandage to adhere it, and I would put it on while I was watching TV or reading. I use this.
Can you say what that bandage is?
Pardon?
Can you say specifically what that bandage is? Do you know?
Yes, it's one of the ones that came with the micropulse, and then I also used tape. Yeah, the one that came with the micropulse worked well, and I also used some hospital tape, and I taped it, and then I put the coils on top of each other, and I used it in the one spot. What ended up happening before I used the micropulse is I had pain all the way down my neck, and the tooth pain caused headaches. As soon as the second day of using the micropulse, my headaches went away and all of the jaw pain went away.
Wow, that is amazing. You know, we had done some. I'm so glad you mentioned that, because one of the first human experiments we did was with people in the dental school at the University of Alexandria in Egypt. Did I tell you about this one?
Yes, I know about this. Yes.
And they actually were doing major craniofacial reconstruction, like the maxillary arch would be all crushed or something from like industrial accidents or warfare or things like that. They would actually do distraction osteogenesis, where they actually pull the bone to create new bone. And it's an incredibly painful procedure done on your face. Normally they do that to lengthen arms and legs, right? But I think they call it the Ilizarov technique or something, but it's distraction osteogenesis, where you put a little slit in the bone and stretch it, and it grows new bone in between, so you can actually make bones bigger and longer that way. And this was a kind of surgery they were doing. They were doing it pro bono surgeries for these people in Egypt, in rural Egypt, who couldn't afford anything. So they would go in, like sort of like a cleft palate surgery they do there. This was a craniofacial reconstruction. And they had real problems with it because it was so painful. And these people, they were just like pouring drugs into them. And we only got half the study done because that's when the Arab Spring happened. And so everything got stopped in Egypt. But the first half of the study, people were like, I'm not in pain. And one guy handed back a whole bottle of opioids. And it was interesting because he had been previously flagged as a sort of a drug seeker because he was in so much pain. They're like, well, be careful what you give this guy because he's always asking. He actually handed back a bottle of opioids, right? Because he said, I don't need them. And, his typical experience is similar to mine. I can understand that. You only take them because you need them. You don't take them Well, some people, but most people, I think, take them because they need them, and
Right.
didn't need them. So that was amazing, and they were shocked by that. And they also did post-surgical milestones. How well should they have healed at 2 weeks, 4 weeks, 6 weeks?
Right.
And they were all reaching their 6-week milestones by 3 weeks. So they were healing like twice as fast with almost no pain in about the most painful surgery you can have, which is full reconstruction of your face, right? So anyway, that's the other piece of information we have that's similar. And I've actually used it on my own teeth because I had one of these, endodontist pointed out that I had this sort of fibrous growth inside a tooth, and it was he said the chances are basically 100% you're going to lose that tooth within a year or two. And, he showed me the progressive x-rays, how the shadow was getting larger and larger, and it was up to like 4 millimeters or something. He said, yeah, past 2 millimeters long, you're done. He said, we don't know why it happens, but if you injure your tooth, maybe when you're playing soccer or something when you're a kid, later in life, it causes you to lose like a bicuspid, right? And sure enough, I used just the micropulse just for a little while, just a couple of weeks.
Yeah.
At night for an hour or two. All of a sudden he's like, I've never seen this before. It's like shrinking, right? Instead of growing.
Right.
So and this was about 3 years ago, and I haven't lost the tooth. There's no sign of me losing the tooth now. And instead of it progressively getting larger, I don't think there's ever been a recorded case of it, receding, but that's what happened with me.
I think I developed an infection in mine, and the micropulse decreasing the inflammation helped the infection to go away. I told a physician friend of mine about it because he has ongoing dental pain.
Yeah.
And his question for me, which I'm passing on to you, he wants to know, can you put the coil inside of the mouth?
Yeah, absolutely you can. I don't think they taste very good. If that tells you anything. I've also tested it where I've pulled them apart and I've gotten the metal sticking out and put it on my tongue just in case to test to make sure that I know what's going to happen in the worst case if somebody, but just because I don't want to have anything happen to anybody that hasn't already happened to me, right? So I beat on myself pretty badly with these things. But you know what? You go, yuck, but that's the worst of it. But if you put it in your mouth, it doesn't really, but you don't need to. It doesn't need to be contacting the tissue, right? The best thing to do would be to put exactly what you did, stack them bumpy side to bumpy side, or bumpy sides. Yeah, you want to stack them with bumpy sides together. It'll work a lot better. Or bumpy sides away from yeah, that's the best. It's sort of like stacking poker chips, right? Or bumpy sides away from the skin on both sides of the face. And right across, and it does not need to go inside the mouth. And I've talked to a few people who want to do dental research with it. In fact, there's about maybe 8 or 10 dentists who've used it before. And we still regularly sell them to people who do dental surgery, dental procedures. And they, at first they're like, well, can you get it in the mouth? And they don't understand that it works really well without having to be inside the mouth. I can't think of a reason for it to necessarily be in your mouth. However, the rubbery part, the gray part, that's made out of a medical grade. That's made by it's a medical grade thermoplastic rubber, medical grade TPR. And while I don't recommend putting it in your mouth, it should not hurt you.
Okay.
It didn't hurt me. I fully tested it in this mouth over here.
Good to know. Well, I'm convinced that the micropulse saved my tooth. Had I not had the micropulse, which I didn't for the first 2-3 days of the pain, I would have had a dentist just pull the tooth out. It was much pain.
I think that, when you've got pain in a compartment like that has no ability to expand and give, and all of a sudden you get this pressure from the inflammation and, the swelling, the pain is so unbearable. But I also think that inhibits a lot of what needs to happen to clear out infections, right?
Right.
So I think that it mechanically interferes, and probably in several other ways actually interferes with the tissue process of reducing infection. Now, a lot of people very reasonably ask, because I asked this question, well, if PEMF makes tissues grow, wouldn't it make bacteria and viruses grow? It turns out people have tested this and it does not. So you can test it on, they've done it with gram negative, gram positive. There's a whole dissertation on this actually of a person who was testing it. It was virtually the same waveform that we use actually. It was a 2013 dissertation, I think, in Australia. Excuse me. And he saw about a 10% just barely not quite statistically significant reduction in proliferation rate of bacteria. So I would say, you know, from what I can tell from the scientific literature, PEMF does not make infections worse. If it did, I can tell you there'd be hundreds of people studying it, and, you know, it'd be banned and everything like that. But there's zero evidence that makes infections or cancer worse, as far as I can tell in the literature. It either does nothing because they don't use it right, or it seems to help. And I think that's in the case of both, you know, cancers, tumors. It seems to. There's a bunch of pretty good studies on this for aggressive breast cancers and stuff, as well as infections. If it makes the tissue a little bit better, like in its conditions, it can actually reduce the problem, not make it worse, which is scary to think of, because you don't want somebody to charge into this and then hurt themselves, you know, make things worse. But I can say I've seen no evidence that that's the problem. But people ask that all the time, and they should. You should really worry about that. But I don't see any evidence of it. What seems to happen is just the swelling goes down, and then the tissue is better able to deal with whatever it is, a tumor or infection or whatever.
It was amazing as a researcher to use the micropulse on myself and to have such outstanding results. And it reminded me of one of the participants that I interviewed during my dissertation. He used the micropulse before and after all of his dental appointments. And he said that one of the times he was having a root canal, he did not want the Novocaine, and he used the micropulse. I told my dentist about it when I went to see him for this tooth, and he's actually very interested and wants me to bring the micropulse back and show it to him.
I will say that I've had probably 12 people who've bought it from us tell me that that's what they're doing. In addition to, there's a couple of clinicians who actually do that regularly. They'll pre-treat somebody for 20 or 30 minutes before they actually start, you know, as they're sitting in a waiting room, and then they go and do their procedure, and then they go home with it for a couple of weeks. Apparently, you know, this is what people are telling me. It's all anecdotal, right? But what people are telling me is that that's exactly what they do with it. And so it, you know, especially in your case where, you know, some people, you go into a dental procedure and there's no real terrible inflammation yet until they start carving on you. But in your case, you have, you know, this root issue, and you had this terrible inflammation and pressure and pain. And it just, and the interesting thing, I guess the other interesting question is, okay, now you did this and the pain went away. Did you continue using it for a little while, and what else have you done? Do you actually need a procedure now?
Well, I'll tell you, in the beginning, I did take some ibuprofen. I did not have to take any narcotics because of the micropulse. And I went back to the dentist, and they rechecked the tooth 2 days ago, and they did an x-ray, and they said everything looks normal and looks fine.
Oh my God, you're kidding me.
Yeah. And the only thing he wants to do, he wants me to come back, and he's going to file a little bit on the top of the tooth, flatten it out a little bit so it's not banging the top tooth. But they could not see anything. And he said, "What did you do?" And I said,
"Oh my God,
I used the micropulse."
Oh my God, I didn't know that. I mean, you told me, you know, before we started talking, you know, full disclosure, you said, yeah, I had pretty good results,
serious.
but we didn't talk about the details. I didn't know. Yeah. So I thought what was going to happen was that maybe you had something causing the inflammation or causing the infection, and that the micropulse made it better, and then it made your procedure less traumatic and invasive. But what you're telling me, what I think I'm hearing is you think it's fixed. Is that correct?
I do think it's fixed. And I've been able to eat steak and anything I want for the last about 6 days. I forgot about it. What?
I don't think any amount of micropulse would allow me to eat kale, because I can't eat kale under any circumstances.
Okay.
But if you can eat steak and stuff, that's really great.
Yeah.
You know, sorry, just trying to make things light.
Speaking of eating, I need to confess to you and to the viewers that the reason my tooth became inflamed is because I found some incredible caramel popcorn. I think I shared some with you at the conference.
You did.
And on the way home, driving home from Florida, I ate an entire bag of caramel popcorn. And by the time I was like a day from being home, my tooth had flared up. So I think it was too much sugar.
You naughty, naughty girl. That is so bad for you. Oh, but you probably had a really wonderful drive. That was really good. Yeah, that was really good because
Yeah,
you gave
no
me
more
some.
caramel
But
popcorn.
yeah, because Stacey and I were just last month, we were in Orlando. So I was hoping that that didn't happen to you when you were there, but it happened to you sort of after your drive, right? Right after
Right.
you drive.
I
Oh
think
my
it was
gosh.
from too much sugar.
Yep, yep. Well, sugar is the fuel for these things, and
Mm-hmm.
as they love it, and then in your mouth, and that's what gives you dental caries and everything, right? So, wow, that is wonderful. That is wonderful.
Yeah.
I wonder, and this is one of those things that will never get studied in a standard study because somebody sort of has to have a micropulse on them, and when you start getting that kind of pain, you want to use it right away. I will go further and say that several people in my family have avoided dental procedures because of using the micropulse that were pain related.
Mm-hmm.
Used micropulse for a few days, pain went away, went in to see the dentist to have the thing fixed, and they're like, what are you here for, right?
Right.
So, and there's at least a couple of people who are trying to tell me that they're getting some kind of dentin and enamel regrowth. All right, bzz, bzz, bzz. That I'm not really ready to believe that yet because I find that difficult. However, there's a couple of pretty bright people who are well educated medically who are telling me, well, actually, it is living tissue and there might be a potential for regeneration. And there's one person who's testing it quite extensively, and he's actually got photographs that look like they're backwards in time, where his dental caries is getting less and less.
It's like Benjamin Button with the teeth.
It's like a weird Benjamin Button thing. And you know what? I'm still so skeptical. I'm not ready to believe that, but it's something that people can test. And this is kind of this like groundswell, citizen science kind of approach to things. If no one's getting hurt, but lots and lots of people are getting benefit, this is exactly what we need to do. Wow, that was really great.
I just want to say one last thing before I go. I was an ER nurse for 17 years, and I took care of many patients that came into the ER with dental pain. And many patients take narcotics and opioids and for dental pain. And if we could get the micropulse into an ER or a couple of ERs and let them try it for patients that are coming in for acute pain because it was an acute onset, and try it in ERs, I think that might be a good idea. And
I think so. I think so. What tends to happen is people will buy it for their back or their knee or something, and they've just got it sitting there, sort of like you did, right? And sort of like I have. And then all of a sudden you get, because very few people plan for dental pain, and then all of a sudden you have this. It comes on you like bam, like in a few seconds, and then you're in terrible, debilitating pain. And what do? Well, you don't want to sit around waiting for a week for one of these things to show up or whatever. You just want to pick it up and put it on you. And this is why I'm thinking that PEMF needs to be developed to be something that the average person has in their first aid kit,
repertoire.
It's got to be, exactly. Something they can pull out like a Band-Aid because when you need it, you want it right away. I mean,
That's right.
I've had a few scuffs, and people in my family have had a few like bicycle accidents. And if you can treat it right away, the amount of suffering gets reduced dramatically. But in your case, wow, that's really spectacular, because I was thinking you were going to say, I think what you were thinking when we talked about it briefly was you were saying, well, I think it might have saved me from having to do this, but I thought you were going to.
It saved me having a root canal.
It's actually now the opinion is no root canal necessary, right?
No root canal. It saved me from having the tooth out, because I went to the dentist and I said, take it out now. I don't care. Just take it. And then he said, no, he couldn't do it, whatever. And I went home. I used the micropulse for several days. So it was a week. I came back a week later to the dentist. He redid the x-rays, re-examined it, and he said, everything's fine. Why are you here?
My God, that's awesome. That is really awesome. Well, thank you so much for
sharing
welcome. That. And I think that's something people will be interested in hearing about. All right. Thank you, everyone. I'll see you later.